Hi, my name is Dr. John Hayes. I'm one of the cardiac electrophysiologists at the Queensland Cardiovascular Institute. Cardioversion is when we apply electrical energy across the chest, in particular across the heart, to try and restore the normal heart rhythm. This is done with an energy delivery across the chest using either patches or paddles, and up to 1,000 volts of energy is delivered very shortly across the chest, particularly concentrating on the heart. We don't think of it as voltages so much, we actually think of it as how much energy, and that energy can be adjusted, turned up to 360 joules in some cases. A cardioversion is a very useful way of restoring somebody's heart rhythm. Sometimes it's required urgently. So some of the arrhythmias that people can suffer, things like ventricular fibrillation and ventricular tachycardias, are life-threatening. They will die if they don't receive an electrical cardioversion within minutes. Atrial fibrillation is not such a life-threatening condition. It's a more chronic condition. It's very rare that we need to urgently cardiovert somebody for atrial fibrillation. Atrial fibrillation is something that occurs, it may sustain. Some people it reverts back to normal regular rhythm within minutes or hours, but if it continues to sustain, particularly despite trials of medications to revert it back to a normal regular rhythm, we can think about electrically cardioverting them back to normal regular rhythm. Our biggest concern is the risk of clots and strokes in atrial fibrillation. So the longer somebody's been in atrial fibrillation, the more chance that clots can form. And we don't want to cardiovert them if they're not anticoagulated. So anticoagulation is the cornerstone of reducing and mitigating the risk of clots and strokes. Somebody who develops atrial fibrillation and they're anticoagulated, we can actually look at an early cardioversion, either that day or within the next couple of days as an elective procedure. If somebody's in atrial fibrillation but aren't anticoagulated and the atrial fibrillation sustains longer than 24 hours, we'd be quite concerned about an increasing risk of clots and strokes. We may not be comfortable proceeding with a cardioversion straight away. We may want to anticoagulate somebody for up to 3 or 4 weeks before proceeding with the cardioversion. So the timing of the cardioversion depends a little bit on the circumstances. But certainly, early cardioversion within hours of onset of atrial fibrillation is readily available in many of our emergency departments. What happens when we do a cardioversion? We actually have the patient asleep or sedated, so they're not aware of it. They're comfortable. What we're trying to achieve is all of the cells of the heart activating or depolarizing at the same time, giving the chance for the heart to restore back to its normal rhythm. Often we'd like to make sure that there isn't any clot in the heart, so we might actually have a transesophageal echocardiogram performed electively at the same time, where a tube, an ultrasound probe, is swallowed whilst asleep, so that we can image the heart and making sure that there's no clots in the heart before electrically cardioverting back to sinus rhythm. The whole procedure often only takes about 10 minutes. You're asleep, have the transesophageal echocardiogram, ensure that there's no thrombus, no clot in the heart, and then we can safely proceed with the cardioversion. Sometimes it takes 1 or 2 or sometimes a third shock to achieve this. Once you wake up, you'll be quite comfortable. A little discomfort in the heart will be very transient. It'll disappear in minutes. Does defibrillation always work? The answer is not always. Somebody might have been in atrial fibrillation for years, what we would consider a persistent or a long-term atrial fibrillation. And their heart has changed, it's remodeled. It's not just an electrical problem now, it's actually a structural change in the heart. And restoring sinus rhythm can be challenging. We might actually use some antiarrhythmic agents to help facilitate that. That is, medications such as flecainide, sotalol or amiodarone that your cardiologist may commence you on prior to the cardioversion to enhance the chances of restoring normal regular sinus rhythm with the cardioversion and then hopefully maintaining it whilst that heart heals and remodels, and hopefully we can maintain sinus rhythm in the longer term. Unfortunately, We really don't know until we do the cardioversion whether it's going to be successful, but in at least 95% of people there is acute success in restoring sinus rhythm. What we don't really know is how long the sinus rhythm will be maintained. A cardioversion doesn't cure atrial fibrillation. It allows us to restore normal regular rhythm, and then we have to continue our efforts at maintaining sinus rhythm. That might be with medications, pharmacy, but also lifestyle modification, reducing alcohol intake, exercising, managing sleep apnea, hypertension. All of these comorbidities will increase the risk of atrial fibrillation recurrence. If the atrial fibrillation recurs, we can certainly repeat cardioversions, and we can repeat them many, many times over the course of months or years as required to maintain sinus rhythm. Many people are highly symptomatic with their atrial fibrillation, and they do prefer to be in normal regular rhythm. And using the cardioversion on repeated occasions is symptomatically useful and very safe to be done. If somebody's gone through an ablation strategy to try and restore and maintain sinus rhythm, they may require cardioversions in the periods after the ablation to restore their normal regular sinus rhythm and help facilitate that remodelling and healing of the heart to encourage maintenance of sinus rhythm in the long term. We're very keen to maintain sinus rhythm, particularly in the first few months after the ablation. Maintenance of their normal regular sinus rhythm will enhance the healing of the heart and what we consider to be remodelling, structural changes that help facilitate normal regular rhythm in the long term. So your cardiologist, after they've done an ablation, will be very keen to maintain sinus rhythm, perhaps with the use of some antiarrhythmic medications for a few months, sometimes using an electrical cardioversion to restore sinus rhythm. And if necessary, that can be done a number of times through those few months following the ablation.